Mr. President, honorable ministers, distinguished delegates, distinguished guests at the high table, Dr. Roses, friends and colleagues from the United Nations agencies, ladies and gentlemen, once again, good morning to you. We are meeting at a time when the first influenza pandemic of the 21st century continues to sweep around the world. When the pandemic comes to an end, sometime in the future, we will see a flurry of assessments of the event, its impact, and how it was managed. We will also see what the world's collective action to tackle inequalities really means. The performance of individual governments will be scrutinized, as will that of WHO and that of the international community. The impact will be judged as negligible, or it will be devastating. Officials overreacted or underplayed the threat. The whole thing was overblown, or preparedness was vastly inadequate. The international community did well to address fairness and equity, or it did poorly. All of these diverse perceptions will find some resonance depending on where people lived or worked or went to school when the first pandemic of the 21st century swept through the world. Ladies and gentlemen, I can't come to this region without talking about performance and the world's collective action to tackle this influenza pandemic. Let me offer you my humble assessment so far. Overall, I have to say, the member states in WHO, especially the member states in this region, the development partners, the industry, the UN agencies, and of course, including WHO's Secretariat, have done well. I can give you specific examples to illustrate my assessment. Globally, I want to thank you, alongside with other member states, for your return on investment. What investment am I talking about? Your investment in building health system capacity in the last few years under the threat of H5N1. You strengthened surveillance and laboratory capacity, and we are in a better position now than in 2003 when the world was scrambling to deal with SARS. But we are not there yet. We're still a long way to get to where we would like to land in terms of health system capacity. The second point I'd like to make is, I want to thank the wisdom of my member states for revising and ultimately adopting the International Health Regulation 2005, implemented in 2007. This is an important legal framework because it provides the platform for countries and for the Secretariat to act responsibly and promptly in our response to this pandemic. And I also want to give you some specific examples of the leadership and the commitment from this region. As a matter of fact, on 24th of April this year, it is in this very building that the colleagues from the region and myself were connected to Mexico, and I'd like to thank the Honorable Minister from Mexico, Dr. Cordova, for your leadership. And also it is in this city that I had meetings with the Department of Health and Human Services, linked to CDC and other colleagues in the government, where we were actually having the first occasions to examine the evidence available to us. I like to pay tribute to the leadership, transparency, and courage led by the President of Mexico. You provided the world with early warning, and you have suffered great economic loss by sharing information and sharing of viruses. It takes a lot of courage to be the first country to report a new and emerging infection. Unfairly, I have to say, oftentimes, you are rewarded with punishment. your tourism is punished. I have gone through that twice in my previous life, so I know how it feels. I want you to take the credit for alerting the rest of the world so that they are better prepared. Why are you so quiet? I think I need also to mention the leadership in Canada and USA for their admirable management, not only in their country, but also in their solidarity with Mexico and other parts of the world. Other countries like Chile, Argentina, and Brazil, and the list goes on. I thank you for providing us with the information because you are the Southern Hemisphere countries. You provide us with valuable information to share with countries in the Northern Hemisphere to prepare them for the second wave. Thank you very much for that. Scientists, experts from US CDC, alongside with WHO collaborating centers in UK, Japan, Australia, work tirelessly. Actually, many of them did not sleep because I talked to them, to study the virus, to chase after the virus, to make the diagnostic reagents, make them free to all the laboratories in the world under WHO's umbrella, to prepare for the seed vaccines for the pandemic virus and provide them all, the seed virus I mean, provide it free to all manufacturers in developed and developing countries, so that they can move into fast track for making the pandemic vaccine. So I'd like to thank all the governments for their support to WHO so that we can demonstrate as a global community in our timely response to this pandemic. What about the industry? We always criticize the industry. But on this occasion, we have to be fair. Ross donated 5 million doses of Tamiflu to WHO. And I want to tell you, in the early weeks of the pandemic, together with the regional stockpile and the global stockpile, we sent our medicines to 121 developing countries so that at least they have something to treat their patients with. I want to thank Roche for that. Now, what about the vaccine industry? I have already commitment for 150 million doses. Some more are coming and under discussion. This is pandemic vaccines coming to WHO so that I can disseminate them to developing countries. And for that, I want to thank the industry. Don't kill me for thanking the industry. And industry is part of the solution. And this is an excellent example to illustrate the point. Who else do I need to thank? Of course, I have to thank the 9 developed countries, let me rephrase it. Development partners who responded to WHO and also Mr. Secretary General's call for solidarity for releasing 10% of their stockpile of pandemic vaccine through WHO to developing countries. And several of these countries are in your region: Brazil, UK, France, and USA. I thank you for your leadership because several other countries follow suit, and I would like to thank Japan and Germany. And I know another country in this region will make the announcement soon, but I don't want to let the cat out of the bag before your announcement. You know who I'm talking to. Now, the performance of the media, I leave it to your judgment. But I have to say, overall, majority of them have play an important role as the bridge between us, the technical agencies, the technical departments, the bridge between us to the general public. And I want to thank the media for that. Now, last but not the least, the staff in WHO Secretariat responded well. You make me proud to be your DG. I thank you. Now, let's move on. Otherwise, I'm going to cry. But before I go on to other themes, I'd like to say that I might have left out important countries, important areas, or entities that have made contribution to this fight against the pandemic influenza. If I forget to mention you, please excuse me. I personally believe that this pandemic will be a watershed event. Why do I say that? I say this not because we anticipate large numbers of deaths or major disruptions to economies or societies. We do not. WHO continues to assess the impact of the H1N1 pandemic at the global level as moderate. I say this because the consequences are likely to be so uneven and so unfairly felt. The hard-won gains that you have made in MDGs may be reversed, and the prospect of reaching the MDGs by 2015 is ever more remote. I say this because the pandemic is spreading in a world where differences in health status, in access to care, in quality of care, and in resources for health are greater than at any time in recent history. The overwhelming majority of cases experience mild illness with spontaneous recovery. But as the number of infections mounts in the weeks and months ahead, this largely reassuring picture will be undercut by extremes. Extremes in the clinical spectrum of disease, extremes in public opinion, in access to vaccines and other interventions, in response capacity and in impact. The world will see proof of the validity of arguments public health has been making for decades. Weak health systems cost lives. Equity matters in health in a life and death manner. This is nothing new, ladies and gentlemen. This is true for a multitude of diseases and health conditions like HIV, TB, malaria, NCD, maternal and child health. But in this case, the exactly same virus causes manageable disruption in wealthy countries, but devastation for health care elsewhere. We will see what inequity really means in a measurable way in a compressed time frame. We will see this under the spotlights, the bright spotlights of public concern and media attention. Clinically, this is a virus of extremes. It does not seem to have a middle ground. At one extreme are the very mild diseases. At the other extreme is a small subset of patients who rapidly fall seriously ill, sometimes going from normal respiratory function to multiple organ failure within 24 hours. Even if the proportion of severe cases remains small, the numbers will grow and the burden will get bigger as more and more people become infected. Emergency rooms and intensive care units will feel the true heat of the pandemic. Saving these lives depends on rapid access to highly specialized care in highly specialized facilities that are simply not available in large parts of the developing world. I do not need to say any more. Let me now turn to other subjects. Ladies and gentlemen, this region is the center of excellence for primary health care. This region understands the importance of making equity as an explicit policy objective. This region has been at the forefront of efforts to address the social determinants of health. As Dr. Roses noted in her annual report, this region takes the principles of primary health care into account in all activities aimed at technical cooperation. In her report, Dr. Roses has much to say about the region's new vision of primary health care. She cites abundant experience showing that this is the most effective approach for promoting equitable and sustainable improvements in health. Strong health systems organized and managed according to the principles of primary health care, give countries the resilience needed to weather global crises like the severe economic downturn, a climate that is changing for the worse, and an influenza pandemic that is now unstoppable. I also agree with her observation that many of the challenges facing public health today are largely similar to those that gave rise to the declaration of Alma Ata 3 decades ago. These issues are well worth raising again at a time of economic upheaval and turbulent change. The financial crisis hit the world where it hurts the most: money. The world has to pay attention. Leaders in sectors with far more clout than public health are experiencing a major shift, a shift in thinking about how this world operates at the international level. We are seeing a shift in thinking about what we collectively want to achieve. We are hearing high-level talk about the need to give international systems and policies a moral dimension and make them responsive to the genuine values and concerns of society. We saw this at the G20 summit last week, which is forging a new world economic order that is inherently more inclusive and more fair. We hear calls for values like community, equity, and social justice that are new in the vocabulary of world leaders in the past, but very familiar to us in public health. These are the values long embodied in the primary healthcare approach. Perhaps some of our age-old arguments will now be heard as the influenza pandemic, in parallel, proves the point that, in a way, that will be hard to ignore. Ministers, ladies and gentlemen, I wish you a most productive meeting. In doing so, I also urge you to persist in your agendas for primary health care, equity, and social justice, in your unique spirit of Pan-American solidarity. Thank you.